Hey, Dr. Young, how are you?
I'm better. I'm present and accounted for.
Oh, bless your heart. Hey, Raven. I'm going to log in on my other computer, Raven, but we are live and it's recording.
Okay. Could you bring this supporting for me? Thank you.
So clean.
Hello. Good evening, everyone. Okay, I'm gonna have my toddler join me, but I am Raye, and I'm so honored to be here with you this evening on behalf of Being the Magic Collaborative. I am a registered nurse and okay, you gotta be quiet. I'm a registered nurse, and most of my experience has primarily been in public health, focusing on supporting mothers and children. I have a passion for maternal child health, and I consider myself to be an advocate in the field of maternal child health, social justice, and health equity. I am also a certified full spectrum doula and breastfeeding specialist, and I'm currently pursuing my certification in perinatal mood disorders and studying for the IBCLC exam because I recognize the need for comprehensive care for the maternal population and for more lactation consultants that look like me, which is one reason why I am so excited for tonight's topic of the power of skin to skin contact and its benefits for mamas and babies. And I see Leslie just joined us. So now I will move into introducing Leslie and Dr. Young. I'm so excited to be presenting alongside both of you tonight. So Leslie is a perinatal registered nurse and an international board certified lactation consultant. She is also my mentor in the field. She's based in the Atlanta area and she has supported families for over 10 years in this space, and she's a wealth of knowledge. Her passion for birth and lactation began with her own personal experiences with birth and breastfeeding 3 children, including twins, she is still currently nursing as toddlers. She owns and operates Mother Nurture Maternity, which is her private practice where she provides breastfeeding education and support, as well as mentorship to aspiring and new IBCLCs. She's committed to providing quality and equitable lactation services and resources to the community, especially those who are marginalized. She considers it a great honor and privilege to support individuals and families during the perinatal period as an advocate, facilitator, and clinician in Georgia and beyond. So thank you so much, Leslie, for joining us. And also Dr. Young, who is an affiliate associate professor in the Department of Pediatrics and Child Health at Howard University College of Medicine. Dr. Young completed her fellowship in neonatal perinatal medicine at Georgetown University Hospital, and has served as the medical director of the BLESS Breastfeeding Lactation Education Support Services Initiative and former director of the NICU and newborn services at Howard University Hospital. Her clinical and academic practice has centered on improving breastfeeding education for medical professionals and patients' families. Dr. Young is a member of the Alpha Omega Alpha, a fellow of the American Academy of Pediatrics, and additionally, she serves on the board of directors for the DC Breastfeeding Coalition and Rose, Reaching Our Sisters Everywhere. Dr. Young is a national speaker on the benefits of breast milk and breastfeeding for the human infant, and her interests are in developmental outcomes for HIV perinatal transmission and the diabetic diet. I am so excited to be presenting alongside both of you tonight. So Dr. Young, could you please kick us off by telling us all what we mean by the term skin to skin? What is skin to skin? Is it the same as kangaroo care?
Skin to skin is a process we use to improve bonding with mothers and babies. And yes, some people do also call that kangaroo care. As long as the mother and baby are stable, we place the infant on mother's chest. Let me qualify that. We dry the baby off first. We place the infant on mother's chest, usually with a diaper on. That's really to kind of facilitate a longer time. Some babies will pee and poop and do a few things, and sometimes that distracts the mom, so we do that. Also, particularly for women of color, we have babies with hair. And sometimes we will also, in drying them off, it's not just a bald head, it's hair on there. And sometimes we'll put a cap on that. So if the room is drafty, we don't have to worry about the baby getting cold. So that process takes place as soon as after delivery as possible.
Okay.
Mom and baby stay together at least an hour, preferably, or until the first breastfeeding attempt occurs.
Okay. And so I know you mentioned the baby is just maybe has on a cap and they are just dried off. So we want to emphasize that skin to skin is when the baby is actually skin to skin with mom or another family member. It's not when you are wearing like a baby wrap and the baby has on a onesie. That is not what we mean by skin to skin. We're talking about when the skin is actually touching skin, flesh to flesh.
And we do cover them with a blanket, a light blanket, so that the baby doesn't get cold. There's sometimes drafts in the delivery room, and so you just want to be sure that that doesn't occur.
Got you. And you also mentioned, Dr. Young, that as long as the mom and the baby are stable. So are there certain times when skin to skin would not be recommended?
Well, if let's say mom had a lot of blood loss in the delivery process, or complications we see a lot in mothers of color is preeclampsia. And if they've been pre-treated with magnesium, depending on the dose and how long it is, mom may be kind of sleepy and baby may be sleepy as well. Now that doesn't preclude putting the baby skin to skin. It just means that you really have to observe that infant, see what's going on with mommy and baby. And you might be able to do 15 minutes or 30 minutes. And once she comes back to the nursery and mom is more alert, baby can go out and breastfeed. The other maternal sedative hypnotics within 4 hours of delivery. And when I say a sedative hypnotic, I'm talking about the name of a drug just went out. We don't use fentanyl. Like your mom's. But Valium,
Got you.
there are other meds. If it's been within 4 hours of delivery, the baby may have a fair amount of the medication on board. So you have to assess everybody. And if they seem stable, put them together. Those two, though, you're gonna kind of watch that. You're not gonna leave it to pop to stand in, hold the fort. You wanna keep an eye.
Got you. And Leslie, I'm sure as a nurse working with this population, is skin to skin something that you see often offered in the hospital, or is it something that people need to know to advocate for?
It kind of depends on the culture, the hospital where you are. And some hospitals are going to be, especially more like a baby friendly hospital, they're going to be very pro skin to skin, and everybody's been trained to do that. So in that case, I believe that everybody knows to do it and it will offer it most of the time. But I think it still is beneficial to be prepared ahead of time to go in and just know that you want to do that, and that unless there's a contraindication to doing that you should be able to do skin to skin, so that if they're not offering it and it's not happening and they're kind of wrapping the baby up and whisking the baby away, you can be like, wait, hold up, can I have my baby?
Mhm.
Right. I think that's a really good point, because as a doula, I like to always teach my people to advocate for, the things that they want to happen after birth, as long as mom and baby are stable and doing well. And I also teach them that, if there is something going on with mom, that dad or partner can also step in and also do skin to skin. So, either one of you would like to share, like, does that skin to skin with dad or a family member or a partner, does it provide the same benefits for baby?
Just about. I mean, mom's the best. I shouldn't think that. Right?
Yeah. I agree.
Mom is ideal for sure.
It's good.
Hormones are going up on mom and baby. It's a little different. However, if the dad has been oriented to that, sometimes we're stitching and doing other things on mom, and it's not really, that can be really distracting or painful, and it's not wise to leave her holding. And it's great when there's a dad there to take over the process. But you have to remind him that he does have to give it up.
Yeah, I definitely remember getting stitched up while doing skin to skin, and it was not the most comfortable thing, but I didn't want to pass my baby up. So I said I was gonna hold on tight. So I had a baby on my chest and I was eating some pretzels with one hand because I was so hungry. But I guess we should tell our audience a little bit more about the benefits of skin to skin and why this is important. Like what does it do for mom? What does it do for baby?
Exactly.
I think that well, I tend to go back to the breastfeeding perspective. And when breastfeeding, so I want to just talk about that first. With breastfeeding, if the baby is not latching right away, it's not showing those feeding cues right away, skin to skin, a lot of times it will fix it. And in lactation, we kind of have a joke that like skin to skin fixes everything except for like flat nipples and tongue ties. So, no matter what, if somebody comes up to me and is like, this baby won't wake up, or this baby, this or that, or the other. And I'm like, did you do skin to skin? Is the baby skin to skin? That's my first question, because 9 times out of 10, it just works. It just helps. It just works. So I love it for breastfeeding. I love it for NICU moms that have babies and their milk supply is suffering, or they're struggling to get it up. A lot of times those moms, maybe they're getting nothing or just dropped, and they'll do skin to skin and dump it out. It's like, it's magic. It's magic. But as far as just in the initial postpartum period, of course, we know it's great for bonding. We know that it's great for stabilizing baby's blood sugar, temperature, and whatnot. And those things are so important because that's going to prevent mom and baby from getting separated. Sometimes they can transition out of some just minor, a little bit low blood sugar and just a little bit low temperature just by doing skin to skin, and they never have to be separated. And sometimes I think they get whisked away when it could have maybe been prevented if they would have been doing skin to skin and been doing it properly, because sometimes they got the baby, even if they have it naked, they got the baby like on its side, and you got the baby like smushed up there. So I just feel like it's magic and it fixes everything.
And it is so important, as you said, to do it properly, and also have patience. If mommy is not having any kind of problems and baby isn't either, I mean, he just had his head squeezed while he came out the canal. Sometimes they got to orient themselves. Give them time. That baby walk or crawl we talk about, they will, especially the near term or term infant, can crawl across that chest and suckle. Even mothers who didn't think they wanted to breastfeed get surprised when the baby takes the initiative. The baby gets on the breast, and all the stories you heard about it, making her toes curl and all that didn't happen. And so now you have a mother that has a whole different view of what's possible.
Yeah, that's beautiful.
It is. And so like with skin to skin, you get the trigger of the hormones being released and the stress reduction, and it kind of helps mom come back after going through the experience of labor. And so it sounds like it helps promote that emotional well-being. But then also for baby, I know from my experience, it can also help them regulate like their heartbeat and their breathing too, because I had a full-term baby. My son was born at 39 weeks and 5 days, so about as close as you can get to full term. But he did have jaundice, and so he wasn't on me all the time because they wanted him underneath the lights. And so every time he would go under those lights, his breathing would get all wonky and crazy. And then as soon as I would pick him up and put him in skin to skin, he would be fine. And I don't know why it took multiple nurses for them to teach me that I could still have the light on him and still have him skin to skin. And then we could have prevented all of the episodes of irregular sporadic breathing, had I known that. But I'm here now, and I try to educate all of my clients about jaundice and different options and how skin to skin can help. And we won't go into that today because I know we want to stay on skin to skin, but it's just really important to know the benefits of skin to skin and the impact that it can have.
One of the hormone pieces for skin to skin is it makes you, mothers, I'm gonna use a different word, oxytocin. It makes it go, the oxytocin go up. We call that the love hormone, but we also know that causes the uterus to contract. In fact, if you have a baby in the car or outside of a controlled delivery setting, you want that baby to go to the breast as soon as possible because you decrease the mother's risk for postpartum hemorrhage or bleeding after delivery. We also know that that oxytocin wakes that baby's brain up, and we've got some studies that show it enhances brain activity, and they're more bonded and more focused, and they're looking at mom and mama's looking at baby, and that's a whole connection that gets started that is just unique.
I mean, it sounds like skin to skin is so magical. Like, can you do too much of it? Yeah, for the new mamas, or the moms who are about to have babies, I'm sure they're wondering, like, can I just spend all of the time doing skin to skin? Why do I need to put my baby on clothes anyway? It's overrated.
For one, you can wear a baby out. That sounds strange, but it can be too much stimulation, and that's one thing you look for to see if the baby's losing attention or kind of pulling back. They still have to learn to regulate their temp at some point, so they can't stay there all the time. And plus, moms have other things to do. You know, you're gonna bleed and cramp and other little funny things that you can improve it in that experience by skin to skin. But we want them back and forth so that mom can get some rest. Rest is the most important thing a mother can do, and fatigue is the most important thing that causes decreased milk supply. So you don't want to wear a mom out if possible.
Got you. That makes sense. And then that's also why, other family members and members of the village can also swoop in and help mom and help that baby to regulate if need be by also practicing skin to skin. So is it beneficial only during that first golden hour, or is this a practice that we can take home, we could do during the early days? I know a lot of moms I see on social media now complain about colic or just babies that have trouble regulating when they get home from the hospital, especially like on day 2. Do you recommend doing skin to skin then?
Definitely, yeah. It helps both mother and baby regulate. The time spent varies. I don't like moms to take it more than an hour. Like I said, fatigue is an issue, and it's one that often gets overlooked in our communities. We need to get that village who's going to help us together. That's probably the biggest thing. You can go out and buy hoodies and diapers and all that stuff, but you need that other hand. And that's something that I see differently. One thing, working at Howard, we work with women from across the diaspora, and you can almost tell this is an African-American woman because nobody's there for the delivery. Or maybe there's just one. And the Hispanics, the Africans from the continent, and everybody brings women, the women come. And that's an important piece. And that person will help preserve your skin to skin, because when everybody wants to pass the baby around, that person will take the baby. It's time for baby to be alone.
Got you. I am in a rural part of Georgia, so I haven't worked with a super wide, diverse population, but I too have noticed a difference in African American moms giving birth and then other peoples of color, and just the way that the mom is almost like honored and protected during that sacred postpartum period, and just the amount of support that they have too. And so like for the mom who might not have that village, what are ways that they can incorporate skin to skin into their routine, have like other children or obligations? What do you all recommend them to do?
I'll let you take that.
I do have the option to do some baby wearing, because that kind of at least allows the mom to get up and around moving and kind of multitask and do other things as she feels, that she can. If she's gonna be trying to, cook or do something light around the house, at least she can kind of move around and still keep that bond going with the baby. And because if you have a baby, especially if you have a baby that's very fussy, you're still not gonna be able to get anything done. If you have a baby that's not gonna let you put them down, then you can't get anything done whether you're sitting there or not. So at least if you can wear the baby, that's kind of a win-win situation. Everybody's benefiting from it, and that's what I like about some of the baby wraps, that you can kind of just keep the baby right there and do other things. And then once mom gets up and out and about, she can continue to do that baby wearing out and about.
Even when mom has on clothes, she can unbutton. So it's the contact, it's the stimulation of her breathing and her voice that baby's been listening to since conception. All those things can calm the infant down. So even if you can't lay down and do that time frame, you can wear the baby, she said.
Do you have any baby wraps that you recommend for moms in the early days that, maybe are like softer and allow for better skin to skin contact?
They have so many different ones that have come out to the market now. So there's some really cool ones I've seen that are actually kind of like a shirt, and it's like a tube top. Those are nice, especially in that recovery period and in the hospital, and when mom's home just trying to recover from birth, and doing a lot of breastfeeding and everything. But also just the jersey wrap type. The Moby wrap is the brand that most people are familiar with, but just stretchy jersey material. You can get it very inexpensively, or even just buy the material from the fabric store. And there's certain measurements that you can look up. They're easy to find online, and even just make your own wrap. But the material is very, very soft, and it's very, very stretchy. So when they're just little like that, you can make it fit, and it lasts for a good little long while. Those jersey wraps, as baby gets a little bit bigger, they don't give you maybe quite enough support, but when baby's really small and in that newborn phase, they're perfect.
Yeah, I really enjoyed using the Moby wrap in the early days. I just felt like it felt better, which is just a long piece of stretchy fabric. So I just felt like it just felt good. And I also felt like that snugness was also good for my son as well. I think we don't talk enough about like that transitional fourth trimester period in general. And like helping people to understand that your baby is going through this period where they've been attached to you nonstop in this warm and cozy environment, and they knew you were right there, and they heard your heartbeat, and now they're born, and there's all these lights and sounds and different people. And so that skin to skin and that baby wearing and that bonding really does help during that transitional period. I see Vanessa has joined us, and I think now would be a good time to see if anybody has any questions from your end.
You're muted, Vanessa.
We can't hear you, even though it says you're not muted. Still can't hear you. And I guess we can also create some space where if anybody is tuned in virtually, if you have any questions, feel free to put those questions in the chat and we can get to those too. And we also had some pre-submitted questions. So while our Arizona people work out their sound mic issues, we can answer one of those questions. And one of those was, are there any resources or support groups available to new parents who want to learn more about the benefits and best practices of skin to skin contact? What do you all share with your people?
I think a general postpartum support group, moms with, new babies, new moms, new babies, that they're all kind of in that same window of time. I think, that would be a good topic to bring up in any mom group that you might be a part of.
The pandemic created a lot of opportunities for women of all colors and ages. And so, you listen to see if the things they're saying make sense, first of all, and check a couple of them out, and wherever you kind of gravitate, that's probably a good spot.
Got you. I tend to send people to Postpartum Support International because they have such a wide variety of free support groups. And that is one of my tried and true trusted recommendations for support groups. Okay, let's see if Vanessa.
Okay, can you hear me?
Yes.
We can hear you.
Oh, we're so excited to be here in Arizona, and thank you so much for all of the explanation of skin to skin. It was great, but we have a few questions from the audience.
Mhm.
Go ahead.
What is the duration of skin to skin? Like, how long are we doing this for? And for how many days? Like, do you do this every day until they're 5, or how long do we do this for?
I don't think it's up to mom and baby, actually. We have to remember that the babies come through us, but they aren't us. And they may have their own, they come with their own personalities, and if you don't recognize, you'll soon recognize you are not in charge, okay? But so you can kind of see what works for you and the baby and your household. I think the first year is a common effect, most definitely in the first 3 to 6 months. But there are kids who like longer than that, 1 year, 2 years, 3 years. It's up to mom and baby.
I was gonna say I have an almost 5-year-old who I feel like tries to crawl inside of my skin when he gets home from school. So I don't think it ever goes away.
That's so true. If you get sick and you still have a living mama, you find yourself sitting on her bed or laying down there, and you well grown.
It's amazing how our bodies work and how we can bring comfort to our baby right after delivery, but all our life through. That's so beautiful. Thank you so much for sharing. I have another question for you. What is the benefit of other family members doing skin to skin? Can it still regulate the baby's heart and help them? Like if something were to happen to mom and be at a C-section that she didn't plan on, would it benefit the baby to be skin to skin with dad?
The temperature wise, yes, as far as stabilizing that, and as far as the bonding, yeah.
Definitely.
Awesome. Do we have any other questions? Okay, so could you expand more about other family members doing skin to skin with the baby and what that does for mom and baby?
Well, for mom, it can give her a rest if she's tiring and the baby still wants more time in someone's chest. So that's one thing it can do. If as I say, the women gather, there may be a particular grandmother or aunt or father or uncle that the baby finds themselves comfortable with, and you won't know that unless you move them around. And then sometimes babies don't want anybody but their mother. That can be a little challenging. So you try to find at least one other person that the baby will do skin to skin with at some point in time.
And so how long do you recommend it for? So is it hour session a couple of times a day, or what is like the duration for skin to skin? If you were to prescribe it, like how would you write out the time for skin to skin for a baby?
I'm gonna let Dr. Young answer that because I can't prescribe as a nurse. But as a nurse, I'm saying PRN. Like we're gonna follow the baby's cues and we're gonna do it for as long as they will tolerate it, as long as they're enjoying it and mom is enjoying it as much as they need to, especially throughout the 4th trimester.
That first month. That depends on her schedules too, and whether she's requiring on a lot of pain meds afterwards. The one thing we didn't talk about some of the risk with skin to skin if mother's sedated, if she's too lax or the baby's tone is too lax, they can roll off the bed. You don't want that to happen, especially not in the delivery room. So those are kind of things you guard against by monitoring mommy and baby closely.
Gotcha.
So can you talk more about the 4th trimester? Like what exactly is that? What does that mean for the baby? And what does it mean for mom?
Well, for the baby, it's just a month. But mom, 4th trimester, I'm leaving it to the doulas and the postpartum nurse here. That is a time when she is supposed to put herself back together. And interestingly enough, in Leviticus, it says the woman should be separated from the camp 40 to 42 days after delivery. So that's an old reference. And 42 days is 6 weeks. So it really does kind of take time for that uterus to come back and get that tone back, the bleeding to slow down. Baby's skin to skin helps that oxytocin. Suckling helps to do that. And if we can get moms, not just to lay down, but to rest, we have a lot less of them needed depends at age 50.
Yes.
I'm serious.
Yes, I believe it. I mean, I just remember my own birth when I had other kids and all that. I'd be tempted to cook, but I read about that 4th trimester, so I knew I had to freeze the meals ahead of time and do the little things you can do while you're pregnant to make space for yourself, even if you don't have that village. I know so many of us are, living our lonelier lives than we were in the past. And there's still things you can do during pregnancy to set yourself up to rest in that 4th trimester.
Mhm.
So thanks for sharing.
Yeah, that's like a whole nother, that's the time for the baby to adjust to being outside of the womb. Just like what you were talking about earlier, Raven, about how on the second night the baby wakes up and freaks out that they're not in the womb anymore. That's a thing. And then throughout the 4th trimester, those first few months, they're really just adjusting to the world outside of you. You're both adjusted to being 2 separate people. So I think it can be a co-regulation type of thing.
Right.
Absolutely. I remember my own doula would tell me like you're supposed to be in the bed and then you can be like around the bed and then you can be out of the room, but you shouldn't be 3 days postpartum and you just went home and now you're up trying to cook like a whole meal. And I feel like honoring that 4th trimester period is just something that's been like lost culturally, and like people who are trying to even incorporate skin to skin might be getting pushback from family members because they just aren't familiar with it. Like, Vanessa, is that something that you had to navigate with your family or your village, or like Leslie and Dr. Young? What would you tell somebody who is like getting pushback from family about doing skin to skin?
Hopefully that person came to a prenatal care visit with you at some point, and because that helps. That helps give you some connection to work with. I'm old, and they weren't really talking about skin to skin, even though I think it was in the 1960s they really first started about it, but it wasn't a big push. And so sometimes that urge just happens to moms to put the baby there, whether they've been told or not, and you can reinforce that. But as time came forward, we do more of we make a point in asking about skin to skin and getting babies there, even for moms who were C-sections, or they may not be able to do it in the delivery room, depending on the anesthesiologist, actually, because that person is watching mommy's breathing. And then they also have to keep an eye on the baby unless the nurse, who's the baby's nurse, stands close by. Because there was a reason, and it wasn't a scheduled C-section. There was a reason why they had to go get that baby. So you kind of, if anesthesia doesn't want to do that watch, then you can wait until you're getting ready to move the mom to recovery, and the baby can go over on the mother's chest then and get transported and get that skin to skin. So even if it's deferred a little bit, it doesn't have to be a no.
I love
Gotcha.
that you shared that. I actually got to experience that with my first birth. It was a scheduled C-section, baby was breech. And in the recovery room, I think she was like 20 minutes after she was born, I was able to connect with her, and they laid her in my chest. And it just amazed me that she did the breast crawl at that moment. A few moments after she met my chest, she started doing that breast crawl and opened her mouth wide and wanted to nurse. And it was just amazing the power that we have as mothers and that connection to the baby skin to skin. I'm just so in awe of this process. Thank you so much for shedding light on that.
You're welcome. And I did want to say we have a couple of questions from the virtual audience. So I wanted to give a little space to answer those questions too. And the first one's it says, in terms of preemie babies, would you recommend skin to skin for every NICU visit?
It depends on the age of the baby, the size of the baby, and what kind of lines and things. Although we will put babies on moms with lines in, you really have to protect that access. That arterial and venous access are so precious. And it depends on mom's comfort too, because some of them are very nervous about the tiny baby. These days, if we know we got a preemie coming and we can pre-treat that baby with steroids and post-treat that baby with surfactant, what used to be a no-no for a 27-weeker, let's say, you can put that baby skin to skin on mom, and you might be able to do it in the delivery room. You put the pulse ox on them, so you know what the oxygen is, and it's always amazing to me to see it float up. They put their little heads there, and they can float up. Now, I'm not gonna leave that baby out there an hour, sorry.
That's amazing. That's amazing that you can do that with a 27-weeker.
You just have to watch them.
And is this something that a mom would be able to go into the NICU and discuss, obviously, with the care team, if it is something that they desire? Is skin to skin something that they can advocate for, like if they're having an extended NICU stay?
Absolutely. And now NICU nurses, for the most part, that they're looking for the opportunity for mom to do skin to skin, because a lot of moms are shy about it, they're nervous. And you set it up for them, because they're disrobing to some extent. You have to be sure you're protecting their privacy. The nurses usually schedule a time with mom so that they know that they can be free and other people can step in if they need to assist them. Mm-hmm.
We had another question in the chat, and it was, would skin to skin be helpful for moms who are experiencing baby blues?
Absolutely. And in fact, hopefully, if they have a depression issue in their history, we got that baby skin to skin at delivery.
That's good.
Because if you don't know, you won't really know how important that piece is to mom's hormonal stimulation. But sometimes moms have true baby blues, that even if it just happens, especially NICU, but even term, it just helps stimulate a bonding to mothers. And I'm concerned if I have a mother with a stable infant who does not want to put that baby skin to skin. that's a flag to me.
Wow. So you said if you have a mom with a term baby, that's a red flag. So what kind of things would you be looking out for with that mom?
How she handles the baby, whether she's breastfeeding, if she's also not breastfeeding, that can also be a challenge. And sometimes you just have to ask. You just have to ask, how you feeling, mom? What's going on? And because if you don't ask, too many will not volunteer. They will not volunteer there. And a lot of times the nurses, postpartum nurses, the doulas will report it to us in the nursery that this mom just lays a baby in the cot in the room with her. She doesn't really interact. And those observations are important too. And it can happen to anyone.
I think that's good to know, like I mentioned in the beginning, understanding and learning more about both during pregnancy and postpartum mood disorders is a passion for me because I had postpartum anxiety that went undiagnosed for a long period of time. So I'm always wanting to learn so that I can educate both my clients and their families about things to look out for so that people can get the support that they need early on.
And, even outside of any type of perinatal mood disorder, I think sometimes it takes just some deconditioning for ourselves because it depends on how you were raised and how you see people around you taking care of babies. Right. So if they're wrapping the baby, no, you gotta put the baby down. Don't hold them. You're gonna spoil them. That type of thing. Those are the things that sometimes are just subconsciously ingrained in us that we're like, oh, I don't want to hold the baby too much because I don't want to spoil her because I got stuff to do.
Absolutely, especially I feel like in this day and age and with social media and everybody portraying how much they can do so fast after having a baby, it's almost like, how fast can I make this baby independent where they don't need me as much, they don't rely on me as much, they're just quiet, they know how to self-soothe, they know how to do everything themselves. So skin to skin is almost like going backwards a little bit, if that's your thought process going into motherhood, where we have to skin to skin almost like forces you to tap back into those like biological responses and reflexes.
Yeah, I agree.
And that's where your village is important too. Are the women that are around you? They're noticing that you just want to put the baby down all the time. They need to kind of step in and get you some help. Because the baby will soon not ask for your presence. They will start, not crying. You're not interacting with them. And so you have created a whole nother problem. Because the trust is the first thing that infant has to establish. And trust is you're holding me, you're feeding me, you're smiling at me, you're talking to me. And although those things seem like they're little, they're so important for infant stimulation and brain stimulation. And if it doesn't happen, it is a problem. And pediatricians also take a look at that. We do postpartum testing. Well, most pediatricians' office now do the 4 Ps, as they call it, where they look for your adjustment. And if you're scoring low on that, they're quick to get you to some support.
I'm glad that they're doing that. It's really important.
Mhm.
I think having more pediatricians who are knowledgeable and supportive of skin to skin and who understand breastfeeding, especially in the early days, is really key for people, especially that want to breastfeed, because if you have a pediatrician who is discouraging, skin to skin, who is discouraging paying attention to those early hunger cues, and, that can make or break a breastfeeding relationship. And that was another question, and this will definitely be for Leslie is like, are there any positions or techniques, any ways of doing skin to skin that are particularly helpful for promoting successful breastfeeding?
More like a laid back positioning, lean back, allows baby to really, that and those instincts to kick in for them to do the breast crawl and for them to just start looking around for the breast. A lot of times, especially if you're a first time mom, you're sitting up and you're trying to look down, you can't really see what you're doing and you're awkward and the baby's head's flopping around and the baby's wiggling around and you get all flustered. But if you kind of like lean back with the baby, then it's like you kind of relax, the baby kind of relaxes, and like gravity kind of makes the baby be able to latch on a lot better. And there's also trigger points like down their ribs and the inside of their legs that actually trigger when they're touching your body, that actually trigger them to start looking for the breast.
Mhm.
I've heard Vanessa mention the breast crawl, and you just mentioned it as well. Like, can you all explain that to our audience? Like, what is that? When does it happen? What are our new moms gonna look out for?
So in a perfect world, like in a perfect, world with no interventions and all of that, that breast crawls just like what you're going to see on a video where, you just wait a few minutes and the baby, usually I think within a couple of hours, normally it would happen. But a lot of times, even within the first hour, that's why I think why the golden hour kind of became a thing, because during that time, it's usually when breastfeeding is facilitated and initiated by the baby itself. But once we start doing a lot of intervention, sometimes the anesthesia and the medications mom's on and things like that, they interfere, even epidural. I mean, like some of those things, they interfere. So it's not that the baby won't do it. It's just that I think it's a little bit suppressed. So sometimes some babies will, and some of them it affects more than others, but then some, they're just going to get real sleepy and just go to sleep. And you might miss that window. And then if you're in the hospital, you're kind of surrounded by the nurses and people, and they're like, everything's kind of moving. And if sadly, when it comes to breastfeeding, if you don't kind of like try to get that first feeding going, somebody's going to throw out, oh, let's just give the baby a bottle. So that's why there's kind of like this pressure to get a feeding in that window of time, if possible, even just some hand expression, something going. So that's why sometimes I think they don't necessarily wait for the baby just to find the breast and to latch on. But if a baby's left alone and there's not intervention, I think usually within that first hour, their natural instincts are programmed, biologically to start looking for the breast, and all those cues. They go through like several stages and phases, little alert period, and all this little phases, and it just leads to them finding the breast and latching on.
And if you're watching them, when they start that licking and head turning, sometimes you can give them just a little nudge.
Mhm. Mhm. Yeah, that's what I like to do. Like, oh, he's trying. Let me just help you a little bit.
Let me just scoot you up just a little bit.
Well, we have a question from the audience here. You touched a little bit on hand expression. Would you mind just expanding on that just for a moment? I know we're talking skin to skin, but it's related for that initial production. Would you mind expanding on what that is?
So hand expression is a matter of just expressing some drops of breast milk for the baby. Some people do it actually even prenatally, and they will collect some colostrum if they're low risk and have some milk that they can bring with them to the hospital. It's really good if the baby has like low blood sugars or you're separated from the baby. It gives you something that you can actually give the baby. And then in the beginning, I love hand expression because hand expression drops the colostrum for the baby. If your baby's not latching right off, that just kind of takes, here, let's give the baby a bottle off the table, because we have a colostrum. We can give that baby drops of colostrum, and normally that's fine, and that's enough for them for a term baby, for a baby that's doing well and is stable. Those drops in that hand expression, the mom can do that every 2 to 3 hours for like that first 24 hours, even if the baby never latched, and probably be just fine without supplementing.
And I'm sorry, go ahead, Dr. Young.
No, I said absolutely, that's right.
Okay, I was gonna share that I did the latch during the golden hour, and I can't exactly remember where things went south with breastfeeding for me, but somewhere along that time in the hospital, I ended up having to hand express, and I would put it in like a little medicine cup. And the nurses gave me like little syringes to give it to him to supplement with my own milk, because pumping wasn't going very well. But I could use hand expression to supplement with my own milk instead of giving formula, because that was something that was very important to me. So I feel like hand expression is a skill that we all need to have. We all need to learn it, and we all need to be able to teach it to somebody in the village, because you never know when you'll need to use it.
That was a very valid point, Raven. The hand expression in that first like couple of days works better than a pump. You can get milk out better, more easily with hand expression than you can with a pump. And you might pump and not get anything, but you might hand express and be able to, get quite a bit that you can either give baby in a spoon or a little medicine cup or a syringe, or even just drop your finger, or you can drip it in their mouth. You can do it all different type of ways.
And we always should remember that the pump is always at the end of your arm. So even if you forgot your electric pump, you still have a way to pump at work. There's no reason to freak out. You can do hand expression, and women did it for thousands of years.
Might be labor intensive, but it will do the job.
Sometimes once they get the flow of it,
Quick.
I have mothers that could beat the pump with hand expression. So it just depends. It's technique, and
That could be an Olympic sport.
Absolutely. And I have also had clients who said, nope, just give me my collection cup and I'll just hand express, because I can get it out way better than the pump can.
Yeah.
We did get one more question, and I know we're almost at time. So there was a question that came through that said, in terms of babies who have been abandoned or experiencing withdrawal from the mother's substance abuse, how would holding the baby impact their healing and development? I'll be volunteering as a doula at a hospital to assist in this way.
Well, skin to skin is still important for those babies. Usually there is a nurse or a caretaker, ones that have been abandoned. There's usually a nurse or a caretaker that takes on that, the role of holding, or volunteer. Sometimes they'll do skin to skin. Sometimes they'll just put in the baby on the chest. It depends on how old the baby is and what that person's mindset is. But that's very important for the baby. For mothers who are substance users themselves, it depends on what they're using. I mean, there's sometimes we can work with them depending on what they're on, and schedule feeding around that, or the doses that they have. And sometimes that actually changes their whole perspective of what they can do. It's an empowering moment for them. And I've seen some others go on to decide to wean back their methadone because they were just so shocked that the baby had so much to offer them.
Thank you for that. And thank you for being a doula to volunteer to help moms and babies in that space. Okay. We got one more question that just came through. It says, if we have time, can we run down some benefits of skin to skin for dads, non-breastfeeding parents? I came in a little late, so sorry if it was covered. Yeah, we did talk a little bit about that earlier, and we talked about how, it can promote that bonding. It can give mom break and rest and help the baby to bond in those earlier days when mom is that familiar safe space. It can help baby to bond with other members of the village, which is important because the mom will need that space for rest as well.
Can I chime in for just 1 second? I think one of the things that I feel like dads and support people in the room, they can really help mom and baby do skin to skin. It sounds easy, like, just putting your baby skin to skin, but sometimes you were cut or you have a tear or something is going on with your body, and you might need to ask those people and let them know, and that's okay and normal. Hey, can you help me get comfortable so that I can do skin to skin? Or can they do skin to skin? Because I think it's all about that fourth trimester for mom or you need to just recover and rest. And sometimes it's something as simple as skin to skin might still be something where you need to ask for assistance, and it's okay and it's normal and it happens.
It also engages dad in a whole different way. They too often they're not in the picture. They're in the picture, but they don't think the picture includes them for real. They're just sort of sitting on the side.
You can
But-
definitely see when they do skin to skin, you can definitely see how something clicks, and they just seem so proud. And so I think it does make them naturally become more engaged with the baby.
And they're surprised when that baby looks up at them when they talk, because they forget that baby has been hearing their voice all that time too, and they will turn to that familiar male voice, and that can always just blow them away. They're so surprised.
It's precious.
It is precious. I know we only have 3 minutes left, so I wanted to give our in-person attendees one more chance to ask any questions. I heard there was a little test or quiz going on, so if you need a question answered, now is the time.
We have all so much. We don't have any more questions. You guys are so amazing.
Oh, thank you all so much. Dr. Young, Leslie, did you all have any closing thoughts, any final advice to give our attendees?
Get your village. Find those women that will really help you. We need to not forget that village. There's a reason for it. They're supposed to do that cooking, and you're just not supposed to be standing around and trying to put all the pieces together yourself if possible. And you'd be surprised who would help.
Agree. And I think for me, it's just consider skin to skin to be like a reset button. And if it's not going well, let's just start at square one, skin to skin. Let's go back to that. And a lot of times it'll make things better.
Absolutely. I would just want to echo, like those evenings and that like the first 2 weeks when my baby was going crazy, I'll be like, okay, I don't know what to do, but we just gonna start fresh with some skin to skin and we'll go from there. Like I can't latch you while you're screaming at me. I can't do anything, but we're just gonna start fresh with skin to skin. And 9 times out of 10, it works. It just helps them calm, and then okay, we can figure out what the issue is and go from there. So thank you both so much. I really enjoyed talking about the power of skin to skin and the benefits with you all. Thank you to all of our attendees. We hope you learned something. Take this information and share it so that you can spread this knowledge with the village and create village who understands the importance of skin to skin and supporting those new mamas and those new babies as they transition throughout their 4th trimester. All right, and I hope you all have a good evening. Thank you.
Bye.
All right, bye.